Hello to all. So since this is our first class, I'd like to give some introduction regarding this topic, pharmacology. So basically, pharmacology is the science of drugs. In Greek, pharmakon means drug and logos means discourse in. So as it is saying, pharmacology is the science of drugs. So this subject mainly deals with the study of what drug will do. Like whenever you consume a drug, then what will happen? See, drug is a chemical substance and it is an exogenous substance. Okay, so when you consume such kind of chemical exogenous substance, after consuming it, this drug is likely to interact with organs, tissues and various cells, even receptors of our body, and after interacting with these systems, some kind of reactions will be produced. Okay, it may be useful, it may be useless. Useful means whenever we are suffering from some kind of disease, at that time only we will consume a drug and we will expect that our disease will get treated. But some kind of useless actions are also produced, like you people might be knowing large amount of adverse effects are produced by a drug. Okay, so pharmacology in general will be the study of the drug, what kind of actions are being produced, like wanted actions as well as unwanted actions, plus what is the mechanism of action of these drugs, and with what receptor it will interacting. Sometimes one drug may interact with some another drug also, some kind of drug interactions may also happen. So basically this subjects will deal with the study of entire science of the drug. So in a broad sense, it deals with the interaction of exogenously administered chemical molecules with living systems or any single chemical substance which can produce a biological response as a drug. It encompasses all aspects of knowledge about drugs, but most importantly those that are relevant to effective and safe use of medical purpose. Okay, so this is pharmacology. Now, as I am saying, pharmacology is the science of drug, so you people should also know about a drug. So, drug is derived from a French word drogue, that means a dry herb. So, WHO has given a definition for drug that goes like this. Drug is any substance or product that is used or is intended to be used to modify or explore physiological system or pathological states for the benefit of the recipient. Okay. Now here it is saying it is intended. Okay, so our intention should be good. See, we are consuming any drug with an intention that this drug should treat the disease. Okay, so it may treat or it may not treat. Okay, suppose the severity of disease is so much high that we require some higher level or more strong drug. Okay, so a drug may treat the disease or it may not treat the disease, but our intention should be like the drug should treat the disease. So it is intended to be used to modify or explore physiological system or pathological states. Okay, pathological states means it is a disease condition and we need to improve a disease condition. But I want to emphasize one thing, that is modify or explore physiological system. Like take an example of oral contraceptives. Okay, I believe you people know that oral contraceptive is a drug, isn't it? You accept this thing. But why oral contraceptives are used? Oral contraceptives are used to prevent pregnancy. So is pregnancy a disease condition? No, isn't it? So pregnancy is not a disease condition, but it is a kind of physiological system, a physiological condition, and we need to explore or we need to modify that physiological condition. Like we don't want pregnancy, we are avoiding pregnancy, so we are taking oral contraceptives. Okay, so a drug, it can be used for the treatment of disease or it can be used to modify or explore a physiological condition like that of pregnancy. Okay, so drug is used for these conditions. So in general, drug, it is a single active chemical entity present in a medicine that is used for diagnosis, prevention and treatment, or you can say cure or mitigation of a disease. See, diagnosis means to detect whether any disease is there or not. And you people now might be thinking that for diagnosis, so many devices are been available. Like if you want to check the temperature, we have got thermometer. If you want to check the blood pressure, we have got sphygmomanometer. If you want to check the blood glucose level, we have got so many glucometers. If you want to check any kind of disease, we have got devices for it. But there are certain conditions, there are certain circumstances where we require drug. Like if you want to take x-ray of any bone, okay, and if that x-ray is not clear enough, so in that condition we are giving a drug known as bismuth sulfate so that the x-ray should occur more clearly. Okay, so sometimes drugs are used for diagnosis. Next, drugs are also used for prevention of diseases. Like you people might be knowing about vaccination. Okay, in childhood only vaccination are been given so that in future the child will not suffer or it will not get affected by the disease. Like we have got polio vaccine, dpt, diphtheria, for measles. So many vaccinations are been available. Okay, so vaccines are also coming under the category of drug. And lastly, drugs are used in the treatment. Okay, so this is a straightforward use of a drug. Okay, next, there are two main divisions of pharmacology. They are pharmacokinetics and pharmacodynamics. Okay, so this is the two important pillar of pharmacology. Pharmacokinetics is derived from a Greek word where kinesis means movement, and pharmacokinetics mainly deals with like what body does to the drug. Like this refers to movement of the drug in and alteration of the drug by the body, and it basically includes absorption, distribution, metabolism and elimination. Like whenever you consume any drug via your oral cavity, it will enter into your gastrointestinal tract. Next, after coming inside the gastrointestinal tract, that drug, it should undergo disintegration and then it should undergo dissolution and it should actually dissolve in the body fluid. Okay, after dissolving in the body fluid, it will enter into the blood circulation, that is known as absorption. Once the drug enters into the blood circulation, from the blood it will reach to the target area. Like if you are suffering from headache, then that drug should reach to the receptor which is responsible for producing headache. So that is known as distribution. After producing the action, we don't want the drug anymore inside our body. So metabolism of the drug will initiate it, and after metabolism, the drug will get eliminated from our body. So this is pharmacokinetics. Whenever we consume drug, after entering inside our body, the drug will undergo 4 steps. That is absorption, distribution, metabolism and finally elimination. And these 4 steps are being done or explored on the drug by our body. So this is known as pharmacokinetics. This is the entire journey of the drug. Okay, what the drug experiences inside our body, that is pharmacokinetics. Okay, next is pharmacodynamics. In Greek, dynamics means power. So basically pharmacodynamics means what drug does to the body. Okay, so here physiological and biochemical effects of the drug and their mechanism of action at organ system or subcellular or macromolecular levels are being done. Like whenever you consume any drug, here in pharmacodynamics, we will study that drug will interact with what kind of receptor. After interacting with that receptor, what kind of biochemical changes are being produced inside our body. And because of those changes in the biochemical things in our body, what kind of actions are being produced. Whether therapeutic action is produced or some kind of adverse effects are produced. Whether that drug is interacting with some other drug or whether that drug is interacting with any food that we have consumed. So all these studies will come under pharmacodynamics. Pharmacodynamics refers to action of the drug, the action that drug is producing to our body. Okay, that is pharmacodynamics. Pharmacokinetics means the effect that body is endorsing on the drug, that is pharmacokinetics. So these are the two important things that we should know, and we will start our study with pharmacokinetics. Okay, so once we complete this introduction to pharmacology, the next thing is the route of drug administration, and then we will start with pharmacokinetics. The last thing that you should know in the introduction part is the risk and benefit ratio. See, we know drugs are there and drugs are used for the treatment of diseases. But before consuming any drug, or any doctor before prescribing any drug, he should know the risk and benefit ratio of that particular drug. If risk is more than benefit, then there will be stupidity to consume such kind of drug. But if benefit is more than risk, then better to consume that drug. Okay, like if suppose any person is suffering from some kind of disease like hypertension. Okay, any person is suffering from hypertension or cancer, so that person will be consuming the antihypertensive drug or anti-cancer drug, like whatever disease that person is suffering from. Just we take an example of hypertension. Okay, any person is suffering from hypertension and we know hypertension is a problem of lifelong. Okay, so lifelong that person should consume antihypertensive drugs. Now that particular person, if he compresses with some another problem like typhoid or malaria, so that person will take anti-malarial or anti-typhoid drug as well. Okay, but already he is taking anti-hypertensive drug, so there are chances that this anti-malarial drug may interact with the anti-hypertensive drug. There may be some kind of drug interaction. So before saying that okay, that person is suffering from typhoid, so give him anti-typhoid drugs and the thing will be sorted out. But before prescribing that thing, we should know, okay, benefit is there, but is there any risk that hypertension will be more increased or not? So that is the thing, risk and benefit ratio. Moreover, suppose you are suffering from some kind of problem, very minute problem, and for that minute problem, if you are taking very strong drug, that is also a problematic thing. Okay, if the problem is minute, you take some weak drugs. Weak drug means low power drug like antibiotics. Okay, if you are suffering from some kind of antibacterial problem and the bacterial infection, then you better prefer antibacterials which are of low power. Okay, less strength antibiotics you can prefer. But if you are suffering from a very highly dangerous infectious bacterial infection, in that case you can prefer very strong strength of antibiotics. Okay, but when you are suffering from very minute bacterial infection, and for treating that much minute bacterial infection, if you are consuming very strong antibiotics, means it will be a problem to you only. Because any drug, if it is producing any kind of useful therapeutic action, but the other side of the coin is it will produce some kind of adverse effect also. So this thing, risk and benefit ratio, I'll be explaining this thing with the help of a very simple example. Suppose this is your any kind of blood vessel, and in this blood vessel a thrombus has been formed. Thrombus means it is a blood clot, and you know, when blood clot is present in the blood vessel, it will obstruct the normal circulation of the blood. Okay. Now for treating this thrombus, for dissolving this thrombus, obviously you will consume some kind of thrombolytic agent. And a very good example of thrombolytic agent is streptokinase. Streptokinase very easily it can dissolve that thrombus and solve the problem. But the problem with streptokinase is it is a very strong thrombolytic agent. It is so strong that instead of this thrombus, it will also dissolve any other thrombus which is present inside our body. And in our body, physiologically, naturally, some thrombus are present. Like in our brain, naturally some thrombus are present over there. And when this streptokinase is dissolving the thrombus which is naturally present inside our brain, it will lead to cerebral hemorrhage, which is obviously not a good thing. Okay, so streptokinase, no doubt, it will dissolve the thrombus and it will treat the problem, but it will also produce an adverse effect of cerebral hemorrhage. Okay, now suppose this kind of thrombus is present in the coronary artery. You know what is coronary artery? It is a very important artery which is supplying the oxygenated blood to the heart. Okay, and when on this coronary artery thrombus is present, it will obstruct the supply of blood to the heart. And now when heart is not getting blood, then what will happen? Yes, it will lead to myocardial infarction, and we don't want myocardial infarction. So in that case, we can prescribe that person streptokinase. Okay, no doubt risk and benefit ratio is there, because if you are not giving streptokinase, the person will be going to have a myocardial infarction. But if we are giving streptokinase, there are chances of cerebral hemorrhage. Okay, there are chances of, it may cause or it may not cause the cerebral hemorrhage, but this streptokinase will treat, sure and short, it will treat coronary artery. So we can prescribe that person streptokinase. So if not cerebral hemorrhage, but the myocardial infarction will be prevented. Okay, but suppose such kind of thrombus is there in some kind of peripheral vein. Okay, in peripheral vein thrombus has been formed, and in this condition if you are prescribing a streptokinase, means no, it is not a good decision for prescribing streptokinase when the thrombus is there in the peripheral vein, because the benefit is very small. See, if in peripheral, in leg, if thrombus is there, then it is of not that much problematic. But when thrombus is there in the coronary artery, we have got only one artery which is supplying the oxygenated blood to the heart, that is coronary artery. But if it is present in the coronary vein, thrombus is present in the coronary vein, means it is not of that much problem. Okay, we can just stay alive. There won't be any problem of myocardial infarction when thrombus is there in the peripheral vein. Okay, and in for treating the thrombus of the peripheral vein, if you are taking a risk of cerebral hemorrhage, means it is a very bad decision. Okay, so in pharmacology we will also deal with the risk and benefit ratio. I hope you understood this introduction to pharmacology subject. Thank you.